Hello, everyone. Good morning. Happy Sunday. We are going to get started in just 2 minutes, so we'll give everyone a couple of minutes to get settled. But hi, Mitzi. Hi, Todd. Hi, guys. Thank you so much for coming on a Sunday. I know it's Sunday can be a sacred day for many people, so we appreciate you taking the time out of your weekends to join us. For those of you who don't know me, my name is Sumaira. I am a patient living with seronegative neuromyelitis optica spectrum disorder. I actually live in Boston, but I have a very special connection to Atlanta. Not such a professional story, but I'll tell you. So we used to come here a lot. I'm of Bangladeshi origin, and if you live here, you know there's a lot of Bangladeshis in Atlanta. So we'd come and see our friends and family here growing up. And my middle name, many people don't know, is Prema, which in my language means love. And somebody in Atlanta heard my sister calling me Prema, and they're like, Pamela? And I was like, no. And then my sisters, my older sisters, who of course bullied me all the time, were like, I was, 12 maybe, and they're like, yeah, it's like Pamela Anderson. And to this day, both of my sisters, 20 years later, call me Pamela. And that nickname originated here in Atlanta. So whenever they call me that, I think of Atlanta. And I also visited a fantastic store yesterday, thanks to Stephanie Evanson, called Labels. So I may have to come back to Atlanta just to go back to that store. But anyway, thank you all so much for being here. I hope it's a wonderful day for you. We're going to try to make this as impactful, as interactive as possible, as engaging. But we have a really jam-packed schedule for you today. We're so fortunate to have so many wonderful experts in the room with us. So today is for you as patients, as caregivers, and even as clinicians. There's so much listening and learning that's going to happen today. So don't be shy. Ask questions. There is no such thing as a stupid question ever. And make friends. I have a question. For how many of you is this the first time you're meeting another patient in real life? Raise your hand. Wow. Oh my gosh. That's a really big deal. I remember the first time I met another patient in real life, and it really changed the trajectory of how I dealt with my illness, because I realized, like, okay, this is rare, but there are others out there with this. So I hope today is really special for all of you, especially those who have never met another patient in real life. So first and foremost, I'd love to thank Dr. Grace Gombolay, Dr. Spencer Hutto, and Dr. Mitzi Joy Williams, all local neuroimmunologists and experts, for collaborating on this event with us. We're so grateful for all of your support. Thank you to Amgen, Alexion, and UCB, without whose support this event would not be possible. Thank you to our speakers, our patient panelists, our caregiver panelists, our experts. We have some folks from industry who will speak to us today, so thank you so much. And of course, thanks to you for showing up. As a patient, I know that sometimes talking about our illness or being constantly reminded of it can be, annoying. We're trying to live our best lives and not let any of this define us. But my message to you today is this. This will never define you if you don't let it define you. We cannot let our diagnoses define us, limit us, or consume us from doing the things that we want to do. Sure, our dreams and aspirations may change and they may look different because of this circumstance, but maybe things will end up better. So I hope today you leave with more information, feeling informed, enlightened, engaged, you meet new friends, and that you leave here today feeling for sure that you're not alone, but that you also have a community, because look around. You guys are all local and you all have a lot of common denominators with these diseases. So, with that said, I also need to thank Emory Brain Health Center. Thank you for allowing us to use this beautiful venue. I understand that this is a multidisciplinary center, which is fantastic, a one-stop shop for neurological patients. I wish I had that when I was really going through it, but very special thanks to the Emory Brain Health Center team. So, where is Jill? I need help. I need tech support. We are going to start. Oh, thank you. How do I do this? Which one? Jill is our lovely chief of staff. I'm sure many of you have already engaged with her. She's also my tech support and my therapist. Okay. So, to the right is forward. Is opposite. Okay, this is fine. So which one? Okay. All right. So we're going to do something different today. Usually I keep my presentation at the very end of the day, but I got some feedback in Cleveland and people said, no, you should start with this and tell everyone about your story. So I try my best not to make this foundation about me. I know it has my name on it, but it really is about you guys. But I guess it is important. 10 years later, I realize it is important to tell my story because it did start with me. So I will tell you my story. Oh dear. Oh, what did I do? Yes? Okay. So, ay Dio. All right. This is from 10 years ago. I was 25 years old, very healthy, had no health issues whatsoever. And one day, in June 2014, I woke up and completely lost vision in my right eye. Luck would have it that I worked in ophthalmology. Thank God I worked in ophthalmology because I was evaluated right away. And when I was evaluated and I had my MRI, turns out that I had an idiopathic case of optic neuritis. And at the time, they said that I had a 16% chance of developing MS and that I was severely vitamin D deficient. But the doctors didn't seem very worried. They said, take some vitamin D, your vision will come back within 3 months to a year, move on with your life. So as a 25-year-old young woman, I was like, all right, they're not worried, I'm not worried. So I went on my merry way and I kept partying like a rock star and all of the things. About 4 weeks after my first episode is when things really escalated for me. I lost vision in both of my eyes, and on top of visual field loss, which I'm sure many of you know what that is, I also regressed quite a bit with my acuity. So I used to be 20/20 in both eyes, and in the patch picture for sure, I was 2600 in my right eye and 2120 in my left eye. So I couldn't even identify the E on the Snellen chart that you see in an eye exam office. I also couldn't feel half of my body. The entire left side was numb. It felt like it was on fire and I knew something was very wrong. So long story short, I was rushed to the hospital, back again to see the same group of doctors. And this time I think we all understood this is more than what we thought it was. And I started IV steroids. I started, immunosuppressive therapy. And then I was told that I have neuromyelitis optica. I had no idea what that was. I had never heard of it. And my first question was, am I going to die from this? And in 2014, the answer was not very clear, actually. And everything that you saw on the internet actually said you were going to die within 5 years. And unfortunately, that nonsense is still on the internet. So we need to find a way to get rid of that, Michael, from the internet. But I was obviously scared. And, I'm like, hold on a second. I'm 25. My life is supposed to be just starting right now. It can't be ending. I wanted to be an actress. I wanted to be in fashion. I wanted to do this and that. Like, everything was just a mess. So I looked on the internet. Oh my God, I'm the worst. Okay. I decided to write about what had happened to me on my lifestyle blog that I maintained at the time. Everyone in my life was asking, what happened to Sumaira? Why is she in the hospital? Because again, I was very healthy. It was very shocking to people that I was so severely ill. So instead of texting people individually and emailing people individually, I wrote what happened on my blog. And overnight, this blog post received upwards of 25,000 views. And that was a lot for me. And even in 2024, that would be a lot for me. So what that told me was that A, people are interested in hearing my story, but B, maybe we need to do more to raise awareness about this disease. So, okay, tech support, I think this is delayed. Okay, sorry. So, of course, I was depressed, I was angry, I was confused, I was angry at my body, I was angry at the world, I was just a mess. But somebody sent me this quote. Somebody very special in my life sent me this quote that said, there was a flower in her heart. It just needed more room to bloom. And when she let it free, she showed the world that sometimes the most beautiful things can grow in the darkest of places without the need of light. This really resonated for me because I really couldn't see much, but I started to see things, if that made sense. I looked on the internet and I was like, all right, I cannot find what I'm looking for. I'm a millennial. I use social media. I don't see what I need. So I said, I'm going to take matters into my own hands. I have a degree in public relations. I worked in the entertainment industry for 20 years, and I worked in healthcare. I put all these pieces together, and I acted really fast. So within 2 months of my diagnosis, I announced that I was going to be doing something about this. This was the first article, actually, ever, and that was me when I got discharged after my first episode. Oh my God, does this need a battery change? You gotta help me, sorry. It's okay, it's okay. It worked? Okay. It's a bit delayed, but okay, thank you, I appreciate that. So, here we are today, 10 years later. We just celebrated our 10-year anniversary on Thursday. Many of you were there. And we are now the Sumaira Foundation. We are dedicated to illuminating the darkness of NMOSD, MOGAD, and other rare neuroimmune conditions. Next slide. We are proud to be patient-led, patient-powered, science-driven, therapy-agnostic, and we have 4 pillars that we focus on: awareness, community, advocacy, and research. This is our leadership team. So that's me. That's Michael Devlin. Michael, raise your hand. Jill Sharp, she's our chief of staff. Guillaume Molinier, he's in France. Stephanie Hamzo, she's in Canada. Jasmine Patel, raise your hand. Hello. And then Chelsea Judge, she's based in Ohio. Next slide. We do a lot of different things, but the program that I'm most proud of, I would say, is our ambassador program. Raise your hand if you're an ambassador. Avery, Marie, Nikisha, Alana. Yeah, fantastic. Thank you guys so much for all of what you do. So in 2019, up until that point, I was a one-woman show. We were 5 years old, and a lot of you guys, Millicent included, Misty, I've known you guys for a long time. It's nice to meet you in person. They had been following my journey of living with this disease on social media, but also like trying to do this nonprofit. And so many people asked me, like, how do we get involved? How do we help you? Like, we want to help and get on the Sumaira train. But I didn't have a infrastructure for volunteers at the time. So I created this ambassador program. I was like, let's see what happens, whatever. The first year we had 4 or 5 ambassadors. Marie is one of the originals. She came all the way from New Mexico. She's back there. And now, next slide, we have 75 ambassadors from 27 countries who speak 25 languages, 87% of whom are women, which makes sense because NMO actually affects more women than men. MOGAD is 50-50. And we have 8 caregiver ambassadors, 2 pediatric ambassadors, and 12 clinician ambassadors. You can see the statistics for yourself on the right. So we have 19 folks with African heritage, 12 with Latinx heritage, 11 with Asian heritage, and so on and so forth. I love to show this slide because as a woman of color, as a child of immigrants, I am very passionate about diversity. I think diversity is really what makes the world such a beautiful place and what brings us together. So I knew that if I was going to ever do something community-oriented, I wanted anyone in the world to be able to look at our website, meet our team, and be able to relate to someone in some way, shape, or form. Like, I look like them, or I speak the same language as them, or I also live in a rural community. Next slide. Here's a collage of some of our beautiful ambassadors from all over the world. It's so crazy to see. But yeah, really, truly remarkable individuals who, like myself, said, hey, I have this, but I'm not going to let this stop me. How do we pay it forward and help other people? Next slide. So illuminating the darkness, how do we raise awareness? Next slide. The first program we ever launched 2 months into our genesis was the Voices of NMO, Voices of MOG program. Now, 10 years later, we have over 170 stories in our library from patients, caregivers, and clinicians from around the world. Next slide. Because of my film background, I am very passionate about cinema. So this is actually a thumbnail from the first documentary that we ever did about NMO. This was on PBS a couple of years ago. Many of you may recognize the gentleman in the middle. That's Dr. Sean Pittick. He's the chair of neurology at Mayo Clinic, one of the heavy hitters in NMOSD and MOGAD. Next slide. This is a thumbnail from a documentary we created in France called NMO Bonjour. It's about a patient, an NMOSD patient from Marseille, and we follow her life, we interview her family, and so on and so forth. This actually went on to become a finalist at the World Health Organization Film Festival in 2023. We didn't win, but that's okay. We were selected out of 800 submissions. So for me, that's a win. And celebrities, Michael, who was on the panel? There was a couple of celebrities who saw this. So now I know for sure they know about NMO. So that's a win for me. Next slide. We do a lot of patient education. So these are a variety of programs we have. From the Experts is our webinar series. Demystifying NMO and MOG is our podcast. Understanding MOGAD and clinical trials is dedicated to MOGAD. And then we have a Canadian webinar. Our webinars are actually, we've done them now in 14 languages, which is super cool. Next slide. Creating a global support network. So I never want anyone to feel that loneliness and isolation that I felt when I first got sick. So community is a very big part of what we do. Next slide. We have support group meetings every month, bi-weekly, in all of these different places. So Denmark and Spanish, France, Germany, global, India, Italy, the Netherlands, South Africa, Turkey, United Kingdom, and of course the US. Next slide. We do patient days like today. So I like to joke and say I've been like on my own little Beyonce tour since 2022. It's not as entertaining as her, but since 2022, we've been to Milwaukee, we've been to Dallas, Los Angeles, New York City, Verona, Italy, Paris, France, Boston, Massachusetts, Cleveland, and now Atlanta. For the rest of the year, our schedule is Copenhagen in September, Beijing in September in China, and then Miami in October, and then Italy and France in December. Next slide. These are pictures from our patient days, and you better believe we're going to be doing this today at lunch. So very excited to get our Atlanta group picture together. Next slide. Okay, so all of this flight nonsense kind of wrecked our shipping plans. We had a lot of our boxes did not make it. One of those boxes consisted of our little unicorn, which is our mascot. I wanted to give them to everyone today. But I want to tell you a little short story about our unicorns. So in 2019, a Spanish-speaking family from rural New York contacted me, and they were very stressed out. And they were like, our 6-year-old daughter has NMO. She is in the hospital. She is very, very sick. The doctors are not really understanding. We need help. So I said, okay, let me help. Rolled up my sleeves. Long story short, we arranged for the child to be transported from rural New York to Boston Children's Hospital. Michael Levy and I don't know if you guys know Dr. Levy, but we arranged for the child to be transported to Boston Children's. And unfortunately, the night before she was supposed to arrive, she passed away. Yeah, to this day, the worst story that's ever come so close to me. It's very difficult to talk about, but I'm going to try to do it without crying. It was a huge blow because these diseases already are so difficult, but when they happen to children, this is really unacceptable to me. So it's, not okay. But it lit this fire in me, and I said, how do we prevent kids from dying from this? We can't lose any more children to this. So we did a couple of things. She loved unicorns, so we decided to make our mascot a unicorn for her. And then we created a pediatric research grant called Joanni's Unicorn Grant. So this is how we honor her, this is how we remember her, and whenever we become aware of a child under the age of 18 who has NMOSD or MOGAD or autoimmune encephalitis or now even myasthenia gravis, we send a free care package with the unicorn stickers, bracelets, and all the fun things that we have free of charge. Next slide. So yeah, this is the pediatric research grant that's in her honor. Next slide. NMO patients. We have 4 FDA-approved therapies now. This is a huge deal. We had 0 when I got diagnosed. And not only do we have 4 that are available, there are 4 that work. So I encourage you to go on our website and visit the NMOSD therapies chart. We've tried to make it as patient-friendly as possible. There's voiceover, there's animations, and really it's a way for you to, with your doctor, evaluate which medication may be the best one for you. We also should have printouts of them here too, so take them home, discuss it. But the whole idea here is that you're in a partnership with your doctor, so you decide with your doctor what's best for you. And these treatments are long-term, so it's very important that the discussion is had not just with you, but also with your families, because rare disease affects everyone in the family. Next slide. We also work with these organizations for financial assistance in the U.S. So that's the PAN Foundation, the Assistance Fund, Good Days, NORD. All of us in this room know how expensive healthcare is and how expensive it is to have a rare disease. So these lovely organizations do support patients in the U.S. to help offset costs, whether it's with your copays or helping pay for Uber rides to your infusions or what have you. But I encourage you, again, to go on our website on the patient assistance page and look into it if you need it. It's a judgment-free zone. We just got to do whatever we can to get through our diseases. Next slide. March is NMO Awareness Month. Oh, come on in. March is NMO Awareness Month, as many of you know. Next slide. April is MOGAD Awareness Month. Next slide. These are the two busiest months for us in the year. We take them very seriously, and clearly I like pink and yellow. So these are some landmarks that we've had illuminated pink for us in honor of both of these months. So that's Niagara Falls. The middle on the top is a stadium in Italy. That's the Zakum Bridge in Boston, the Empire State Building, the oldest hotel in Denmark, and CN Tower in Toronto. This year also we had 8 buildings in Warsaw, Poland that just had our logo plastered on it in Polish. I thought that was cool. Next slide. These are just some proclamations that we've gotten. So 37 states in the U.S. recognized March as NMO Awareness Month, and 12 recognized April as MOGAD Awareness Month. This is all fine, but I think we are ready to move towards a federal bill so that this is something that's just done across the board and recognized by everyone all over the country. Next slide. This is a picture of our former Belgian ambassador. She presented on behalf of the organization at the European Parliament about why early detection and early diagnosis can save lives and actually save healthcare systems money. Next slide. This is us at Capitol Hill. Marie is in this picture. We met with many members of U.S. government and urged them to continue supporting rare disease research so that patients like us can have a fair shot at life. Next slide. We fund research. Since 2018, we have funded 32 projects in the amount of $750,000. Next slide. We've also started paying for journal publication fees for physicians who want to publish, but some of you may not know this, to publish a paper in a journal, in a medical journal, sometimes costs upwards of $3,500. In many countries outside of the U.S., that's more than what a physician makes in a month. So we try to help physicians from lower middle income countries publish their great work by paying for their publication fees. Next slide. We recently launched our patient-friendly research summary, so much research going on in NMOSD and MOGAD, which is absolutely fantastic. But if you're like me and science is not your thing, it just goes over my head. I read this stuff and I was like, Michael, translate this for me. I don't know what this means. But now we have patient-friendly research summaries on our website so that people like me can understand what these research articles mean. Next slide. Our website is available in 25 languages. I think this is very important because already in English, our diseases are so hard to understand. So imagine if English is not your first language, how even more difficult it is to understand. So we've got a lot of different languages available on our site. Next slide. We started globally expanding about 3.5 years ago. So we have an entity in Canada. Next slide. An entity in France. We actually just launched our French website last week. Next slide. In Italy. Next slide. Germany. Saudi Arabia. This is something we did in Latin America. We funded the consensus for treatment of NMOSD so that the treatment guidelines are streamlined for the entire continent. Next slide. We launched a case discussion and lecture series for Iranian doctors. It is remote, but this happens about every 2 or 3 months. Next slide. This is actually a billboard in Shanghai, China. It's so crazy. I couldn't even believe this was real. I thought Michael photoshopped this for me, but no, this is real. This was in a very busy square in Shanghai to recognize China's NMO Day, which is May 25th. Next slide. This is one of my favorite pictures. It's a group of fantastic key opinion leaders in NMOSD and MOGAD wearing Barbie t-shirts. Next slide. We are very passionate as an organization about diagnostics. If you think we have it hard here, think about other countries where they don't even have access to getting tested for this stuff. So again, we have a very global lens and very empathetic towards low-resource countries. So as an organization, we are placing a lot of effort into helping patients around the world, specifically in lower middle-income countries, get diagnosed. Because as we all know here, once you are correctly diagnosed, that's everything else just kind of, happens. So, but you need to get correctly diagnosed. Next slide. As part of that Global Diagnostics Initiative, we launched a fellowship at Oxford in the UK last year. So we've now graduated 3 diagnostic fellows. So the idea is, so we have 3. 1 came from Iran, 2 came from Sri Lanka. They go to Oxford University. They learn from the best of the best how to test patients in a very limited resource kind of environment. They go back to their home countries, take that knowledge back with them, train their colleagues, and then they start to test people. So this is one of the many ways we're trying to help diagnostics. Next slide. This is Dr. João Oliveira. He comes from Brazil, University of Sao Paulo. He's actually TSF's first, oh, by the way, we're TSF, like the Sumaira Foundation. Some people can't say my name, and that's totally okay. So you can call us TSF. But this is our first long-term fellow. So he came from Brazil. He's now at Mass General Hospital, where he's going to be researching seronegative NMOSD. Quick poll. Who doesn't test positive for an antibody here? Raise your hand. Okay. From the island of the misfits. I love it. We'll connect later. All right, next slide. We launched an app, and you'll see the QR codes on your table. So this is a symptom tracking app. It's called NeuroSum. We're still in the beginning phases of figuring this out, but I encourage you all to please download it, use it, and give us your feedback, because I'm sure there's a lot of things that we can improve. Next slide. And that's it. So that's my presentation. I hope this sort of helped you understand who we are as an organization, who I am as a person. But I'm really happy that you guys are all here. And with that, let's get this show started.